Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to get to talk to Miley, our medical liaison in pharmacogenomics, about her background as a professional, a little bit of a person, but really excited to hear what she says about pharmacogenomics. And we have 9 different topics to talk about. So, Miley, thanks for being on the podcast today. Why don't you share a little bit about you as a person and then a little bit about you as a professional?
Thank you so much, Zach. Nice to meet you all today, too. It's a pleasure to be here. So thank you so much for having me. So my name is Miley. I'm currently a doctor of pharmacy, and I have a specification in pharmacogenomic from Harvard Medical School. So I'm currently an MSL in pharmacogenomic with UGenome, and I'm also a registered pharmacist in Massachusetts. So it's a pleasure for me to have the opportunity to contribute to the development of UGenome, bringing in pharmacogenomic more accessible to everyone. So the reason why I'm so interested in pharmacogenomic is I want to bring pharmacogenomic closer to patient and also healthcare providers, since I do understand the most important part of medication for patient is for efficacy and the safety for the patient. So I know that pharmacogenomic is going to be a very interesting tools and a very important tools in the future too, to integrate into the healthcare system, to help our patient to get a better treatment and also a very personalized treatment for them based on the genetic makeup, because we all different. We're not going to be respond to the medication same as others. So it's really important to understand more about our health, more about our difference, so we will have a better treatment and a better approach to medication.
Great. Thank you so much. Excellent. So our very first question, and just take your time, is for the average person, what is pharmacogenomics, Miley?
Yeah, so I would try to explain it as much as I can about pharmacogenomic, because it's a very interesting field. So pharmacogenomic to me is a study about how a person's genes influence the response to drug. So we aim to enhance the efficacy and safety of medication by considering the patient individual genetic variation. So the genetic difference of the patient can affect how much the drug are metabolized for the patient, and that difference will lead to variation in the effectiveness of the treatment and also the risk of side effects severity, because the patient gonna have a different type of side effects based on how their drug are metabolized. So this knowledge allowed the personalized treatment tailored to individual genetic makeup and improving the drug effectiveness and also minimizing that adverse effects, the severe adverse effect, and also maybe the mild but consistent adverse effects that affecting quality of life for the patient. So the service that we currently providing, which is the personalized medication service, which is a service that we focus on how pharmacogenomic can help the patient by performing genetic tests to analyze a wide variety of genes that are related to drug metabolism, efficacy, and also the safety for the patient. The results that we got back will be reviewed by a pharmacogenomic pharmacist. So that person or me, which is also a pharmacogenomic pharmacist, will interpret how the genetic variation can affect the response, and maybe we'll provide a lot of recommendation for potential future medication for you to ensure the safety in the future if you're taking any medication that can have a severe side effects for you. And that recommendation will provide you with the information in adjusting drug types, dosage, or avoiding certain medication, like I said, based on genetic makeup. And the process that we have is fairly quick and is typically complete in 3 to 4 weeks. So it's a very important, it's gonna help you in the long run, but it's just gonna be a very quick process for you, and you will receive your full result along with the medical recommendation we will provide for you and also for your healthcare providers to streamline your treatment and improve the outcomes for you.
Great. Thanks. Yeah. So I can attest to that. So over the weekend, I got a box, I opened it up. I filmed myself doing it, but even like filming myself, recording myself doing the pharmacogenomic test, it still took me like 12 minutes. And so I think it's going to take most people who are not going to record themselves doing every single step of the test, maybe 4 minutes. I put it in the mail and I'm looking forward to my results very soon. So thanks, Miley. Appreciate that. So Miley, next question here is a pharmacogenomic test worth my time and money? So a lot of people will think, yeah, sure, it would be great, but is it really worth it?
I would say it would depends on the level of understanding for pharmacogenomics. Once you understand the importance of pharmacogenomics, I think for you, you will understand that will be a very valuable investment in the long run. For example, if you're managing a chronic conditions, taking several medications, for example, the patient with multiple chronic disease like hypertension, diabetes, or maybe chronic heart failure, they're taking a lot of medication, they will experience a lot of unexplainable side effects. So that will be a very good investment for those patients and also for any patient, I would say, because for all the medication, it will react differently with your genetic variation. So if you have a lot of unexplainable side effects or poor response to treatment, we can help you by analyzing the genetic makeup, and the test will provide the insight into how your body metabolize and respond to specific drugs. So this really worth your time and money because we will minimize the trial and error of medication. You're not going to take this medication. You see how it works. We wait how it works. And in the long run, it's actually affecting how the disease is going to progress too. So from this, we can, from this stuff, from pharmacogenomic result, we can tailor the medication for you with your unique genetic profile to enhance the effectiveness of the medication. We can also avoid a drug that cause the side effects to be less effective for you. You like avoiding that medication, which is also a very important problem with taking medication, which is adherence. And also this will optimize the dosage for you too, because we will find the right dose from the beginning. And we will balance between the safety and efficacy. And so in the end, in overall, I would say it will save your time and money by reducing the trial and error. It will increase your quality of life, which is the most valuable thing. Not being getting the side effects that are unwanted and unexplainable, and then you don't understand why. It's just another step forward to understand more about your health, more about how it's going to be different between you and the other patients. And it's going to be a very good tools for healthcare providers like us to understand more about our patients so we can find the best treatment for you from the start.
Great, thanks. So, I mean, certainly I can speak to the time. It took me just a few minutes to do the test myself. Right now, the money cost up front is something, but over the long term, you can save yourself a lot of headaches by not having an adverse drug reaction. And just so everyone knows out there, we're working really hard to find ways to get this reimbursed through various reimbursement mechanisms. So anyway, thanks, Miley, for this really nice conversation. Okay, Miley, so here's a big question. What is the future? This is always a big, when you ever ask the question about the future, it's always a big question like, oh my God. Anyway, what is the future of precision medicine and pharmacogenomics?
Um, yeah, it is a very big question. I would say this is one of the questions that I had to when I get myself into precision medicine and also pharmacogenomics is that what is the future? Is this something that's too new, which is actually not, it's been around for quite a while. But I do believe it's set to revolutionize healthcare by creating a personalized, a data-driven treatment for the patient. So as genetic testing becoming more affordable and accessible for patients, I think that would be very beneficial for us as healthcare providers to be able to tailor therapies for each individual genetic makeup and ensuring that the medication work more effectively with fewer side effects from the start. And optimize medication to match the patient genetic profile. We can improve the patient's safety and quality of life in the long run. So I think that's just all the good thing. And I would love to see that coming stronger, I would say. So it's a really good talk today. So I would love to share what I'm doing now, sharing about pharmacogenomics so the patient or the general population, I would say too, not like only the patient who's currently treatment. So it's really important to understand more about yourself, more about how your genetic makeup will increase your risk for adverse effects or your risk of having a less effective treatment for you, which delay the disease, which do delay like the disease treatment process too. So precision medicine, I think it will shift the focus of treatment to prevention. by identifying the genetic predisposition of the disease earlier, and that the individual can receive a target intervention and minimizing the delayed treatment from the start. So I think it's a very important thing to have in our healthcare system right now. And I can see that pharmacogenomic is gaining its popularity nowadays. The prescriber and also the clinics and also us as a pharmacist, we do really think about pharmacogenomics when considering the metabolism of the drug and the treatment for the patient to see if it's actually good for the patient or it's actually put the patient at risk if they are having that gene variance from the start. So yeah, it's a very good question. Thank you. And yeah, it's a very exciting thing to look out for pharmacogenomic in the coming years.
Excellent. Yeah, so the idea that we can prevent things before we get something is really exciting instead of always reacting. So thank you so much. Okay, next question, Miley. So how do providers choose, so this is more like maybe current state of affairs, how do providers choose a drug for a patient? What's the current standard practice?
That's actually also a very big question. So, yeah, I'm just gonna try to keep it as short and sweet as possible. So, as healthcare provider, when we choose a drug for the patient, first we have to consider the patient medical history. So this includes like existing health conditions. What is the patient's currently taking for the medications? Do they have any allergies? Did they have any previous medication response that really notable? Or they have any adverse reaction? I know adverse reaction is kind of like something really common if you're currently taking any medication. Any medication has adverse reaction, but if it's too severe or if it's too weirdly consistent, like unexplainable, is a really important thing to consider too. Another thing that we use is clinical guidelines. So we always consulting evidence-based guidelines that recommend the most effective treatment for specific conditions, and also having updates from the clinical guidelines to see if there's any new or like better way to treat our patients. And then we will evaluate the effectiveness and safety profile of the medication in relation to the patient conditions that we reviewed. I think another thing that we can integrate into how we can choose a good treatment for the patient is pharmacogenomic information, like I mentioned above. So the genetic test can provide valuable insights into how a patient metabolized certain drugs. So variation in genes, such as the in cytochrome P450 family, can significantly affect the drug metabolism, leading to differences in drug efficacy and the likelihood of adverse reaction. So if we have the result, we can classify the patient as poor, intermediate, extensive, or ultra-rapid metabolizer based on the genetic profile. For example, if the patient is a poor metabolizer, they may require a lower dose of the medication to avoid toxicity, to example. So from that, from all of the important information that we have from the patient, we will create a very tailored treatment for the patient by utilizing pharmacogenomic with other basic information that we always have in hand when in our mind when we consider treatment for our patient. And I believe that this integration will lead to a better outcomes as the patient are more likely to receive the medication that work effectively for their unique genetic makeup.
Great, thanks. So it sounds like pharmacists already work very hard to personalize medications as much as possible, and pharmacogenomics is really a way to extend that and make it better, quicker, more efficacious for everyone involved. So thank you, Miley. Appreciate that. Very cool. So next question is, how do we know if the drug prescribed will work for me? So, we get a random medication prescribed after a quick visit to the ER. We go to the pharmacist. How do we know it's going to work for me?
Yeah, that's like a very chronic questions, right? So I would say there's no guarantee that a drug will work perfectly for every patient when we prescribe them. But like a comprehensive approach, like I just told you in the previous question, would increase the chances that the prescribed medication will be effective for the patient. So we always consider, I will quickly remind again, so it's like medical history, lifestyle, specific health conditions, and also like their genetic makeup, will create to have a tailored treatment plan. So another thing that the patient can know that the patient have a good drug for them is that to monitoring the efficacy of the drug. For example, if they have depression, they should be in high alert for monitoring their mood, their daily activities, or their thought process to have, because for a lot of medication and treatment medication, they have like a lot of like adverse effects that leading to having like really intrusive thoughts. So maybe that's something that I can monitor too. So if the patient have any concern about the specific medication, such as side effects, interaction with their drug, the other drugs that they're currently taking, or interaction with the food that they're taking, or maybe about the patient daily routine too. So they can discuss this with the healthcare provider to ensure that they're currently receiving the best medication for them, to ensure the efficacy, to ensure that their disease are being treated. And it's really important to monitor. For example, there's really high alert drugs that you need to monitor, for example, like warfarin for bleeding risk. They should keep an eye on that to contact with their healthcare providers. So that will allow for the adjustment of the patient treatment plan to ensure the efficacy and ensure the patient meet the unique needs that they having. For example, like they love to eat some specific thing, or they're currently taking some herbal medication that are affecting their drugs or affecting the efficacy of their drug, they should be contact that with the healthcare providers. So the key thing is that always share your concerns or share your problem with the healthcare providers, and we're always here to help. So yeah, that's something that the patient can consider all the time about when they receiving any treatment and a prescribed drug from the healthcare providers.
Great, thanks. So it sounds like the truth is we don't always know how it's going to work. And this is where the patient, him or herself, really comes in. They have to monitor themselves, be very honest with themselves, and report back when there is a problem. So thank you so much, Miley. Great. So next question, how do pharmacogenomics help with treatment decision-making process? So you talked a little bit in the previous section about the decision-making process tangentially. So how does pharmacogenomics as a tool help a pharmacist with the decision-making process, or with a patient with their decision-making process?
Yeah, so like I said, there's no guarantee that the drug will work perfectly when they prescribe it the first time. But I believe that integrating the pharmacogenomic in prescribing can really boost the chance that the prescribed medication will be effective for the patient. So by understanding the genetic makeup, the healthcare provider can select the drugs that fit the patient profile and the medication that are less likely to cause the side effects and more effective for the patient. So the pharmacogenomics, I believe, can help with the treatment decision-making process in several key ways. So first, I would say is that we provide the pharmacogenomic testing result will provide insight into how the patient genetic makeup affect the response to medication. And this will allow the healthcare provider to select a drug that are more likely to be effective for the patient from the start, not from trial and error and trial and error. I'm trying this medication, try that medication that's going to affect the patient mentally too. And another thing I would say is that by understanding the genetic variation, provider can determine the right dosage for each patient and minimizing the risk of side effects or therapeutic failure from the start. For example, if some patient that metabolize their drug more quickly or more slowly, this will affect how much of the medication they need.
Got it.
Thing is that the pharmacogenomic testing can identify the patient at risk for adverse reaction to certain medication. So we will know that in prior, maybe we would choose an alternative drugs, or maybe we would choose a lower dose for them to make it safer for the patient. So with a tailored approach like that, the pharmacogenomic can lead to a better treatment outcomes by ensuring the patient will receive the most appropriate medication for them based on the genetic profile, which is always unique in every patient. And when the patient understands how the genetic influence their treatment, I believe that they will be more engaged in their care, and that will increase drug adherence to, and also increase the communication between the patient and to the healthcare providers. That I believe will lead into a better like prescribing therapies for the patient and ensure the patient is receiving the most safe like I say, safe and always effective for the patient.
Great. So what I'm hearing here is that instead of starting it at 6 out of 10, a good guess on which medications are best for you on current approaches, we could start at an 8.5 or a 9 out of 10, meaning we have a better starting point for a patient to give them the medication they need. Anyway, thank you, Miley. Really appreciate that. Excellent. So next question, what are adverse drug reactions and are they avoidable? So maybe just a basic definition to start with and then kind of walk us through if they're avoidable or not.
Yeah, definitely. So, adverse drug reaction is really easily taken into other form like allergies, pseudoallergies too. That's going to be another realm. So basically, adverse drug reaction or unintended and harmful responses to a medication that the patient have, and that can occur at a normal treatment dose. It's not going to be like an overdose or anything like that. It's just like a normal treatment dose, but that's just some basic thing that the drug have based on that mechanism of the drug. So this reaction can range from mild side effects like nausea, headaches, to very severe, potentially like life-threatening conditions like anaphylaxis or organ failures, or in other cases like Stephen Johnson for some medication of seizure medication, which is really important for the patient because that's something also a gene variation can cause. And the adverse drug reaction can result from a variety of factors, I would say, including the drug pharmacological properties, like I said, the mechanism of a drug. Maybe they're currently taking other drug too that increase the drug level of this drug. So it leads to toxicity and it leads to adverse drug reaction. Hopefully it's a mild one, but in most cases for toxicity, it's a severe case. And in individual patient characteristics too. For example, if the patient is an elder patient, or maybe it's a pediatric patient, or maybe they're male or female. Other thing is like previously I said for genetic factors, for example, like the seizure drug of carbamazepine, that if they have genetic factors variation, they will be more predisposed to a very severe side effects with SGS.
Okay.
And or their underlying health conditions too. For example, if they have a chronic kidney disease or like in the end stage and they have dialysis, they're affecting their drug level in their body, they were more predisposed to having a more severe adverse drug reaction. So in summary was adverse drug reaction are very unpredictable and mostly unavoidable. Many can be anticipated or mitigated through like a vigilant clinical practice. We monitor the patient carefully and maybe utilizing the pharmacogenomic information.
Excellent. So, I mean, it sounds like because we're taking medications, which is something foreign to our body, every medication has the potential to do that. But we have a good sense of which medications and which conditions, you said kidney disease, for example, are more prone to have an adverse drug reaction. So this is really an assistive tool to avoid that and eliminate that as much as possible for the patient himself. Great. So can you give us an example of a person who has had an adverse drug reaction? Obviously not any person as an individual and not named, of course, but maybe on a general level, what this person was experiencing, their condition, how they presented the adverse drug reaction, and kind of walk us through some of that story for us.
I think I have a really great story about relating straight to pharmacogenomics. So for example, this is going to be very general because I've seen many cases. So this is going to be a very general, not going to be specific patient. So for example, a patient's taking statin, which is a medication to lower high cholesterol, which is also a very chronic condition, very common condition in patients in general, in any age, I would say. So such as simvastatin, which is a statin that lower patient cholesterol. So after starting the medication, the patient experienced muscle pain, muscle weakness, unexplainable. They don't know why. They're not like moving around excessively or doing a lot of active thing or anything like that. It's kind of unexplained to have like muscle pain and weakness. And then they run through a genetic test. They share that with their healthcare providers. We recommend a genetic test. And then after the genetic testing reviews that the patient has a variant in the SLCO1B1 genes,
Wow.
which affect transport of the statins in their liver. So this genetic variation can lead to increased level of simvastatin in the blood, so raising the risk of toxicity, which is the thing that causes myelopathy and rhabdomyolysis. So by identifying this genetic predisposition, the healthcare providers can consider an alternative cholesterol-lowering medication for the patient, and also it's kind of like finding the root cause of the problem.
Oh,
And
yeah.
maybe sometimes, if it's not too severe, we can adjust the statin dosage, or in most of the time, we will find an alternative for the patient to ensure the safety of the patient, since they've already experienced the severe adverse effects, which is the rhabdomyolysis or the myopathy already. So yeah, that is an example of how pharmacogenomic can help you, can help the patient to know the adverse effects costs, and also in the future, if the patient, for example, for other patients that not experience the adverse effect yet, they already know the information, and as us know the information too, we can avoid that as a preventive approach, not as a reactive approach.
Yeah, that's super exciting. So the two things that stood out is that very specific gene you mentioned, and then how you can associate that gene in some cases with a root cause. And then we get very much what you said is to the preventative side of pharmacogenomics. You can avoid adverse drug reactions to begin with. And that's really one of the biggest goals that we have as a group, UGenome. So Molly, another question we have is, so how do we recognize adverse drug reactions in ourselves, right? You're walking around, you feel pretty good, and suddenly you don't feel great. What if it's something else? How do we recognize adverse drug reactions?
Uh, Yeah, it's a great question. So, for patients, it's really easy to mix up the adverse drug reaction to something. Maybe you have a stomach ache and then you think that you eat something, or maybe you have a fatigue and then you think you work too much or something like that. So, I think it's a very important thing to be always alert for any unusual symptoms. First, it's to alert for any unusual symptoms, but maybe adding the timing too. So you should keep track of when you start noticing that symptoms, because adverse reaction usually occurs shortly after initiating a medication, or maybe after a dose change. So note of that to see if there's any correlation between the medication initiating and also your symptoms, to see if there, wait, I have never had this GI upset before, stomach upset before when I take this type of food, why I have it now. So is this maybe because of the new medication that I'm taking? Maybe it's the new dosage change that I take. So yeah, that's something that's really important, is that always notice about the timing when you have any changes in your medication, to find that correlation. So and also be mindful about the severe allergic reaction too, because sometimes, I'm sorry, a severe adverse drug reaction. Sorry, that is a totally different thing with allergic reaction. So severe adverse drug reaction, such as difficulty in breathing or swallowing the face or throat, that will require immediate medical attention. So that's really important thing to notice too whenever you're starting a new medication. And reach out if you notice any concerning symptoms to your healthcare providers, so we can assess and adjust your treatment if necessary, because there's actually in some cases that after you're taking the medication for a while, it start to have the adverse drug reaction. It's not always the case that 100% the case that when you just change or you just taking this medication, it's also happen when you take it after a while. So it's really important to contact your healthcare providers if you have any concerns.
Great. So it sounds like, and probably most people who take medications know this already, but still it's good to be aware that usually adverse drug reactions occur in a time-bound way. So from the moment you take the medication till X point in the future, usually fairly soon, you're going to notice something or not. So that's the good thing about adverse drug reactions. Rarely do we have to worry about adverse drug reactions later on. So the good thing is that most of us can sense pretty readily when we have an adverse drug reaction. Okay, thank you, Miley, appreciate that. So Miley, can you give us a nice overview of UGenome's personalized medication service?
Yes, of course. So it's my pleasure to be included in the UGenome for personalized medication service, because I believe it's a very meaningful service too, since we put the benefit of our patient to the top priority. So our service is that we will perform a genetic test to analyze the wide variety of genes that are related to the drug that you're currently taking. And then we will analyze the drug metabolism, the drug efficacy for you, and also the drug safety for you. So the results that going to be sent back from the lab is going to be reviewed by a pharmacogenomic pharmacist, which is me and another pharmacist. Will interpret how the genetic variation, your genetic variation, can affect your response to current potential future medication. And we will make recommendation for adjusting drug types or dosage for you to avoid certain medication based on your genetic makeup.
Thank you, Miley.